Welcome to another edition of the Business and Personal Podcast, where we bring you closer to the people that you do business with. And we're excited today to have Cole Hammond of Hammond Health Service on here. And he's been in the insurance world for more than 10 years and gets great satisfaction of helping people out and simplifying what can be a very stressful process. So, first of all, Cole, thanks for joining us today.
Thank you, Ryan. Appreciate the opportunity to come on and have a little chat with you.
So just kind of to get started here, give people an idea of your background and what got you to this point and why you're so passionate about insurance.
Sure. So, like you said, I've been a licensed insurance advisor since 2010, specialized in the Medicare space. I've always had a passion for helping people. Even as a young guy, I've always liked working with people older than me. For a while, I thought I wanted to be a college professor. Then I got to college and realized what the college students were like, and so on and so forth. Really liked the idea of being an educator, and the idea of helping people understand things that didn't make sense to them. So after I decided I didn't want to be a professor, my eyes were opened up into the insurance world and how it is such a convoluted, ever-changing thing, especially on the Medicare side, and the Affordable Care Act. I'm not aware of too many people that grow up as a kid and say I want to be an insurance advisor, but the ability to, like I said, to make sense of a convoluted federal program that, no matter really who you are, your age, your income, whatever. I mean, you don't have to have insurance, but 95% of people do. So I get a lot of satisfaction of making sense of that for folks and helping them understand it so that they're confident and knowledgeable about their health insurance. They don't need to be able to recite the 400-page Medicare book or know the Affordable Care Act inside and out. That's my job. And again, kind of what I'm passionate about. But I do want all of my clients to have a well-rounded understanding of how their health insurance works, so that, if their friend or family member comes up to them and says, "Oh, what's your health insurance like?" or "How did you get signed up for Medicare? What kind of plan do you have?" Something to that effect. I want all my people to be able to have a 60 and 90-second conversation to explain what's happening. Again, they don't need to be in the weeds and all the details. That's where I come in. But to be able to have my clients understand what they've got, and for them to truly believe it's a good fit for them, not just, I had to throw my hands up and get something to fill the gap. That's where I come in and am passionate about helping people figure out what's right for them as an individual. And since day one in 2010, when I started in the healthcare industry, I've always treated people as just that, as people and as individuals. I'm not a believer in, oh, this is the right plan for everybody, or this is the best plan, or that's just not the way I operate. I never have. I'm really, really passionate about getting to know each individual client. That being said, I don't need to know your mother's maiden name or your blood type or anything like that, but what's important to one individual may not be important to another in regards to a health plan. For example, I've got a lot of clients that say, "Oh, I've been with my doctor for 10, 15, 20 years, and I got to make sure that they're in the network for whatever plan I choose." Cool. Other people say, "Oh, I go to the doctor once a year to get an annual physical, and I hate going to the doctor, so I don't care. I just need to know that my plan is going to cover me. God forbid some sort of catastrophic event happens." Okay, well, then we take a different direction, So getting to know each person and what they want and what they don't want in a health insurance plan kind of drives a lot of how I operate and how I run my business.
Almost seems like you're a stress reliever that, people enter into the insurance sign-up process overwhelmed, stressed out. And not only do you take that stress out by helping them pick the right plan, but also knowing that, hey, they're covered if the worst case happens. How much satisfaction do you get just from that stress relief part of it?
A tremendous amount. I mean, on the Medicare side of things, before COVID was a thing, I used to hold a lot of in-person educational workshops where I'd bring people in turning 65 or starting on the federal program, and I'd educate them on the federal program and how it works, start to finish, in about a 30-minute presentation. And then I do questions and answers afterwards and schedule the one-on-one appointments and help people pick out the plan. So when I first started doing them, where I really started liking doing them. I've always been a public speaker and I've always enjoyed public speaking, but I would literally see people sit in the audience. Just before I get started, you could just see the anxiety and the stress and the, oh my God, what do I do, on their face. And then that dissipates to the presentation, because that's, again, something else that I do, that I try to differentiate myself from other advisors, is that I simplify the process. I've never liked or used the term dumbing it down, because I feel that insinuates somebody's unintelligent from the beginning. But I try to make health insurance digestible in the fact that a high school senior could sit in front of me for a half an hour and they'd have a pretty good idea of what's happening. You don't need to be a rocket scientist to understand it. But yeah, you're right. To physically see people come in just stressed to the max, and then by the time they leave, a handshake and oh my gosh, I get it. That's so much more simple than what I've been seeing on television, and all the flyers I get in the mail, and I was talking to my neighbor and he said this and it made me more confused. But to actually see it on somebody's face, just alleviate, is pretty cool. Yeah.
Well, I'm living proof of that, man, because I was super stressed out. This is my third year of trying to figure out health insurance, being self-employed, and just being disgusted at seeing the premiums skyrocket, and really thinking I only had a couple of options to
Right.
choose from. You completely open up a whole new world to me with the marketplace. I'm just kind of blown away with that. So I believe it. I'm definitely a believer in
Cool.
that side of it. So obviously you cover Medicare. You've talked about that, but what are some of the other types of insurances that you help people with?
Sure. So Medicare is, again, kind of the base of what I do, and since 2010. But I also do a lot of other types of insurance. Pardon me. Dental, vision, and hearing. Nowadays, most of those plans are rolled into one. You don't have to be on Medicare for that. You can buy it at any age over the age of 18 as an individual. So dental, vision, and hearing. And then the Affordable Care Act. So, for example, like you were just talking about, individual people or self-employed folks, or even folks who aren't offered health coverage through their job or through their spouse's job, what do they do? How do you go about figuring that out? And I can come in and I can help with that as well. It is a different world not dealing with the Medicare program. Affordable Care Act is completely separate, obviously. But that is another major focus of mine, is helping self-employed individuals, or again, if you don't have coverage through work or your spouse's work, helping people understand how that Affordable Care Act works, helping them understand the potential federal subsidies out there based on your household income, and so on and so forth. I am not a CPA, I am not an accountant by any means, but I do have pretty in-depth knowledge on how the program works, and to where I can help people determine whether or not if they qualify for any of these federal tax credits or subsidies, based on some questions that we go through and filling out the applications and seeing if we can get them on a plan that, let's say, for example, if a family of 4 was looking at a plan in their area on the Affordable Care Act that was, roughly, call it $1,200 a month for a family of 4. That's, as unfortunate as to say, that's not that uncommon nowadays. Those plans are not going to have a great deductible, but they know they need something. So I can come in and help people work through that Affordable Care Act application, if you will. And depending on their household income, there's a high possibility that they're going to qualify for multiple hundreds of dollars of savings per year based on this federal program that's out there. That's not cheating the system. That's not, the government makes the rules and we follow them, and help people save money. So long and short of it is that, Medicare, dental, vision, and hearing products, Affordable Care Act, and then I also do a pretty fair amount of what's called short-term medical. It is exactly what it sounds like. It's a term length medical plan. Caveat there to those is they do not cover pre-existing conditions, pregnancy, mental health services, or prescription drugs. So that's obviously not a great fit for everybody, but it's an excellent fit for a lot of folks. The way I kind of look at those types of deals is that, and that's actually how I insure myself through a short-term medical plan. Um, it's a catastrophic plan, more or less. If something bad happens to you, you're not going bankrupt, you're not selling your house or anything like that. Um, they are the target audience for those types of policies is usually somebody who is got a year or 2 years before they start Medicare, or somebody younger in age who's in good health. And again, they don't want to pay through the nose for a health insurance premium, and they're a healthy individual. And they just want a CYA in case something bad happens. So those are the four major areas that I work in on the insurance space: Medicare, Affordable Care Act, dental, vision, and hearing plans. Those are standalones. And then short-term medical plans.
And then from a geographic standpoint, the beauty of the internet is, when this podcast gets out there, anybody anywhere might pull it up. I know you're based in the Kansas City market,
Right.
but what areas do you cover?
Well, Kansas City is my home network, where or home, I guess, geographic area. So I'm licensed in the state of Kansas, state of Missouri, Texas, Arizona, and Michigan, along with Arkansas, North Carolina, Virginia, and Georgia. But my main, I guess, concentration of clients that I service is Kansas, Missouri, Texas, Arizona, and Michigan. That's the big 5 states that I work in predominantly.
So going back to the whole stress relief part and your joy of helping people in your 10 plus years, I'm sure you have all kinds of success stories, but give us a couple, one on the Medicare side and one on the marketplace side.
Okay, so I kind of touched briefly on the marketplace side. Started talking to somebody fairly recently, actually, and they'd been working for themselves for a while and didn't have employer options through themselves or their spouse, and they were paying a pretty high premium for a health insurance plan, just because that's kind of all they really knew. They didn't know there was other options out there. And after having several conversations and getting to know the individual and what was important to him and his wife, their children, and their family, and their health insurance needs, I was able to illustrate that let's take a look at the marketplace. It's not necessarily going to be what we do, but let's explore that option. As a 1099 employee, this individual didn't have a W-2, and like I said, didn't have an option of employer coverage. So based on his household income, I was able to get him nearly the identical plan that he presently had: deductibles, co-insurances, maximum annual out-of-pockets, and some additional benefits for roughly $1,000 less than he was paying to go direct with the insurance company. And it's a pretty cool feeling knowing that you just take the time, you treat each person as just that, as a person. Like I said in the beginning, you get to know them and kind of step back for a second, look at the big picture and say, okay, well, let's look at this. And it feels pretty good, to be able to get somebody equivalent to what they were paying, $12,000 a year more than what I was able to help them get it at. So I would definitely say that's probably one of the more rewarding ones, at least the one that comes to the forefront of my mind in regards to the Affordable Care Act. I don't care who you are, how much money you make. $12,000 is $12,000. That goes a long way for a lot of folks. So that would definitely be a big success story for me on the Affordable Care Act side. In regards to Medicare, it's not necessarily a specific story or a specific individual, but I'll kind of paint that picture again about the folks or the type of person that is just so dumbfounded. They don't really, they can't put their head around it. And actually, talking this through, I can think of a specific story in regards to Medicare. So about 3 years ago, roughly, I received a phone call from a referral, or that was a referral from an existing client here in Kansas City. And this woman, she called and she introduced herself, and I could clearly tell she was just beside herself. Her husband had just passed away about a month prior. She was a stay-at-home housewife, raised 3 kids, and her husband took care of all the bills. he just, handled that. She handled the household. That's just the way they, ran their lives. Totally cool. So we scheduled a one-on-one appointment. I went out to her house. This woman was respectfully, she never paid a utility bill. She didn't know how to contact her internet company to figure out why her internet wasn't working. I sat down at the table and I, looked at her bill and okay, well, it's ABC company, and let me get on my phone and Google the phone number, and I got customer service on the phone for it. Before we even started talking about insurance, I helped this gal schedule an appointment to have a technician come out the next day and turn her internet back on. So I want to paint that picture of this woman's scenario about not knowing anything. And she was already on Medicare for 4 years before her husband passed. She was 69. And, she said, here's all my paperwork. And she legitimately probably pulled out 30 to 40 pages of different insurance documents. And it took me about 10 to 15 minutes to kind of actually figure out what was active, what was in force, and what was old stuff. So we kind of separated that out and put the old stuff to the side and said, all right, well, this is what you got now. And we talked through everything. I, again, found out what was important to her. She didn't know what was important. So it was a lot of a fact-finding scenario. I know that I need to see this doctor for this cardiologist, for, this urologist. And, I think she had a podiatrist that she'd been seeing for a long period of time. She said, I really like these guys, and I want to make sure that I can still see them. Okay, cool. So again, looked at the type of Medicare supplement that she had and her prescription drug plan. And based on her health, I was able to qualify her for the exact same Medicare supplement plan G with a different insurance company. Her company was still in business, but they hadn't sold any new policies in about 3 years. Like, she was one of the last new people to come into the pool. And in those 3 years, her premium had increased over 75%. She was paying approximately $500 and some odd a month for what I was able to get her the exact same federally standardized product, Medicare Supplement Plan G. I got it to her for about $130 a month. And when I showed her all this on the computer, again, she was not a technology savvy person, but showed her all this, and this is what you're paying now. Here's your bank account. Here's the check that your husband's in writing, and here's the company that I can get the same thing with for $130 a month, but roughly a $400 savings a month. She started crying, and I said, what's wrong? What's wrong? She said, no, I'm just so happy. You've taken this all away. I didn't know what I was going to do. I had all the stress on my shoulders, not only dealing with my husband, but then how am I going to afford to pay this bill? I didn't know how he was paying it because he'd done it all from the beginning. I actually just did a policy review with that woman about 2 weeks ago, and went over to her house, and we sat down and talked for about 2.5 hours, just catching up and so on and so forth. And that is probably the one that sticks out the most in my mind because, respectfully to her, she was just so naive in how health insurance worked. It was very, very, very fulfilling in my heart to be able to educate her in, an hour and a half on our initial meeting, to where she sent me over 24 referrals in the last 3 years because of how happy and how easy I made it for her to, let's sit down, let's talk, let's figure out what you want, and then let me go to work and do the hard stuff for you. That's the rewarding thing.
Yeah, you're not selling insurance, man. You're selling solutions, which that's the best thing to sell.
Yeah, you're spot on. I've never once considered myself an insurance salesman. I'm an educator, and I help people solve problems that everyone has. And I greatly appreciate the opportunity for every single client that I've ever been able to service, and the ones in the future that allow me to come in and just take that stress away. And I'll raise my hand. I'm the weirdo that likes health insurance and figure it out for people. I don't know why, but it's very rewarding to be able to solve these problems for people.
So Cole, anybody that's listening, watching, that is interested in any of those insurances that you do sell that you mentioned earlier in the podcast, what's the best way for them to get in touch with you and kind of get started with the whole process?
Sure. So the best way is either my telephone number, 913-687-5106, or my email, very simply, Hammond Health Service, and that's singular, hammondhealthservice@gmail.com, or you can visit my website, hammondhealthservice.com. And there's a contact us form there. You fill out your name, telephone number, and email address. It'll come to me in my email, and I'll follow up with an email or a phone call within 24 hours. My customer service is only number 2 of importance to me in my business, outside of number 1 being the knowledge that I have about health insurance. But I want, again, every single person that I interact with to be confident and knowledgeable that they understand what's happening. I'm not the guy who rushes through things just to get the sale done. That is not me at all. If we have to have a dozen appointments and a dozen phone calls before you say, all right, cool, I get it, that's the way I operate. But again, the best way is either my telephone number or an email, or visit my website. So 913-687-5106, hammondhealthservice@gmail, or hammondhealthservice.com.
Fantastic, Cole. Well, hey, thanks for joining us, and look forward to maybe catching up with you down the road.
Absolutely. I appreciate the opportunity to chat with you, Ryan. And thank you so much for having me on.